Hi, my name is Dr. Ross Hauser. Welcome to Fort Myers, Florida at Caring Medical. This year has been a very hard year for my family, for myself, and especially my wife, Marion. We were traveling in February. We were riding our bicycles, going about 20 miles an hour, when her front tire hit my back tire, and then she fell on the concrete and suffered a serious fracture of her pubic ramus, like a really compounded fracture. And so the whole year has been trying to get her back. On her initial x-ray, you can see some widening of the sacroiliac joint, and as well as some widening of the pubic symphysis. So over the course of the last, it's been 7 months now, she's had numerous amounts of prolotherapy to her pubic symphysis as well as her lower back. She's now back to running, cycling, and she's really probably back about 85%. And this is the reason why I put this up is really mainly to show that if there's enough force to injure the bone, like to fracture the bone, you can 100% guarantee that you're going to injure the ligaments too. So the reason why people still have pain or disability after a fracture is normally because during the fracture healing, the orthopedic surgeon tells them to wear a cast or don't bear weight or all these things. Well, immobility is terrible for ligaments. So imagine somebody had a really hard trauma that they fractured a bone and they injured a bunch of ligaments. Now they are immobilized. I mean, it's just a setup for instability or ligaments not healing. Marion's case, I mean, we had her like 4 days after the trauma in the pool walking. We did have to have various friends from around the country live with us for 6 weeks because I still had to work. But she was working out 2 hours a day in the pool. And it was very quickly she was walking, and then within, a couple months she's riding her bike. And it's been a horrible injury, but she's made a remarkable recovery, and she would tell you, and I would tell you, that remarkable recovery is because of prolotherapy. So if you have had a fracture and are still having problems, absolutely consider getting prolotherapy, because almost always it's because of ligament laxity and joint instability that actually started with the trauma that caused the fracture. And the prognosis is excellent because prolotherapy is the treatment of choice to tighten ligaments that are causing joint instability.